Influenza is an infectious disease commonly referred to as the flu. It is caused by influenza viruses and can cause mild to severe illness. The main types of influenza viruses that infect humans are influenza A, B, and C. Influenza has been around for centuries with documented outbreaks, occurring as far back as the 1500s. The word influenza comes from the Italian word meaning influence, initially referring to the belief that the disease was caused by astrological conditions. The first convincing record of an influenza pandemic was in 1510, when it started in East Asia and spread globally. The Spanish flu pandemic of 1918 to 1920 was the most devastating influenza pandemic in history and one of the deadliest pandemics ever recorded. Pathophysiology. Influenza viruses primarily infect the epithelial cells lining the respiratory tract. The virus enters the host cell by binding to sialic acid receptors on the cell surface. Viral HA proteins on the surface of the virus particle mediate this binding. Once bound, the virus enters the cell and uses the host's cellular machinery to replicate. Two main evolutionary processes of influenza viruses are antigenic drift, a gradual accumulation of mutations, and antigenic shift, a sudden, significant change in viral antigens. Clinical manifestations. Influenza symptoms are similar to a cold, but typically more severe. Common symptoms include fever, chills, headache, muscle pain, cough, sore throat, and fatigue. Symptoms usually appear 1 to 4 days after exposure to the virus and last for 2 to 8 days. Children are considered the primary spreaders of influenza. While most people recover fully, influenza can lead to complications, particularly in high-risk groups. Management. Annual vaccination is the most effective way to prevent influenza and its complications. Vaccines are updated annually to keep up with the evolving virus. Other preventative measures include hand washing, covering coughs and sneezes, and staying home when sick. Antiviral drugs, such as oseltamivir and zanamivir, can be used to treat influenza, particularly in severe cases. These medications work by blocking the virus's ability to spread and replicate within the body. Prognosis. For most healthy individuals, influenza is self-limiting and not life-threatening. However, influenza can be severe and even fatal for high-risk groups. These groups include young children, the elderly, pregnant women, and people with certain chronic medical conditions. The most common severe complication is pneumonia, which can be caused by the virus itself or by a secondary bacterial infection. Other complications can include ear infections, sinus infections, and worsening of chronic health problems like asthma.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.